Hi everyone, I am Shahan Laik. Welcome back to my channel, and today I will discuss a very important topic. The topic is mucormycosis. Now mucormycosis is a very important topic for these days because it is very famous because of the post-COVID patients infection. So basically this is known as black fungus disease. So why it is called black fungus? Because some parts of your mouth turns into black because of this fungus. And why the name is mucormycosis? Let me explain to you. Let me erase it and then I will explain what is mucormycosis. Now mucormycosis came from a mold, and the name of the mold is, what is the name of the mold? The name of the mold is Mucormycetes. This portion is same, okay? Mucormycetes, M-Y-C-E-T-S, mucormycetes. So mucormycetes is the mole that cause mucormycosis. So mycosis is the disease, and that is caused by mucormycetes. Okay, mucormycetes. Now let me explain to you what are the symptoms and what is happening in this black fungus disease. Basically, this disease is having some particular signs. So let us discuss the signs and symptoms for this disease. The signs and symptoms for this disease is, number one is headache. Now the headache is, the person is having either a unilateral headache, one-sided headache, or it can be bilateral. So headache is very important. Next is the nasal congestion. There is nasal and paranasal congestion. So there is congestion of the nasal passage, and you know there are so many paranasal sinuses which are there. So these sinus, like the ethmoidal sinus, sphenoid sinus, all these sinuses, maxillary sinus, frontal sinus. Basically, let me explain the sinus first so that it will be clear to you. Suppose this is your face, okay? This is your face. Pardon me for drawing such a horrible face, but anyway, for explaining to you, it's okay, I think. So here you have, here in these portions, you have the frontal sinus. You have the frontal sinus, F-R-O-N-T-A-L, frontal sinus, okay? And in this portion, you have the sphenoid sinus, and just side of it you have ethmoidal sinus, ethmoidal sinus, okay, ethmoidal sinus. And here you have the maxillary, okay, here you have the maxillary sinus. So all these are paranasal sinus. So these are the sinus which is just lying parallel to the nasal sinus, the nose. So these are the paranasal sinus which are affected. Basically, these channels, these paranasal sinus are blocked when this fungus has attacked. And another important features from this thing which we are getting from this fungus is the headache, which let me explain with the help of the picture so that you can understand it well. I think you can understand it better. So suppose this is your head and you are having a single-sided headache, a particular sided headache. Basically, the patient present with a unilateral, this kind of headache is known as unilateral, means a particular side, okay? Unilateral means a particular side, not bilateral. So a particular side, maybe the particular side of the face is affected for this fungus, or it may be bilateral, but more common is the unilateral, one-sided headache, which is there in the post-COVID. The patient is complaining of the unilateral headache, and also nasal congestion, which I told you, the paranasal sinuses are blocked, And sometimes, let me erase this, and sometimes the patient is also complaining of the ophthalmic pain. Sometimes the patient goes to the ophthalmologist and the patient is complaining of eye pain. The patient is complaining of ophthalmic pain. There is a pain which is surrounding the eye, or basically the eye muscles. So the patient also has loss of vision. Because of this, the patient also has loss of vision. This is very fatal. So it is an emergency condition. You need to treat it very well, because the patient may become blind because of this fungus. So you have to treat it very well. It is an emergency condition. And the patient sometimes also have other symptoms, but these are the main symptoms. And let me explain to you who are the patients who are having the main risk. So who are the patients who are at risk? Basically, the patient who is having the diabetes mellitus patient, they are very vulnerable to this fungus. And because they have a high sugar level, high glucose level in their body. Another vulnerable person, number one is this diabetes, number two is the heavy steroid use. Those who have used heavy steroids in the COVID-19 treatment, generally steroids are used. Do you know what is steroids? Steroids are the medication that is used to lower the immune response. That decreases the immune cells fighting. So you can understand steroid as an immunomodulators, that regulates our immune cells and decrease the immune activity that is there inside our body. So steroid makes our immune system weak. So a patient who has already suffered COVID, at the time when the patient is treated with a steroid injection or steroid medication, the patient has already weakened his or her immune system because of the use of the heavy steroid. So that patient have higher chance of getting this mucormycosis. Another patients who are also having this risk factor is the patient who are kept in humid oxygen. So those patients who are in the ICU, those patients who are having oxygen, those who are having the humidified oxygen, they can have this infection. Basically, let us learn how we can prevent from this deadly fungus. This is the deadly fungus, black fungus. So how we can prevent? So prevention, let us learn about the prevention. Okay, this is very, very important, because nowadays it is very, very common. And you know what is the fatality of this virus? The mucormycosis, the mold. What is the fatality of this disease? The fatality is 50%. The fatality is 50%. Okay, so you have to be careful. If 10 people are attacked by this deadly fungus, then 50%, that means 5% are dying. You need to understand it. So those patients who has already suffered COVID-19, they need to be very, very careful. And what are the prevention they need to take? So basically, let us discuss about the preventions for this from this fungus. The first important prevention is you have to be very cautious. You have to wear full sleeves. Okay, well, full sleeves dress and clothes, full sleeves dresses and clothes. And while you are going, number two, when you are going to a construction site, okay, when you are going to a construction site, always wear gloves, always wear full shirts, always wear full sleeves. So in construction sites, do not touch anything. You know what is the site of this virus? What is the site where this what is the site of this fungus? The site of this fungus is, what is the site of this fungus? The site of this fungus is soil. This fungus remains in the soil. You need to be very careful. If you touch the soil, if you are doing some gardening, if you are doing some plantation, you need to be very careful. You need to wash your hands very much regularly. You need to wash your hands with soap, and you need to use sanitizer. So another prevention is use of soap and sanitizer. So sanitizer is the another prevention. So all these things you need to be very, very careful. And for basically the diabetes patient, basically those patients who has already suffered from COVID-19, who were already in the ICU, those patients who has just been recovered from COVID-19, they need to be very, very careful of this fungus. So you have to wear full sleeves, you need to wash your hands regularly, you need to wear masks, you need to when you are going to the construction site, be careful, do not touch anything in the construction sites, and wear full sleeves, and always sanitize your hands. So all these things, you have to always wear masks, so always maintain distance. All these things you have to maintain. Just next is let us go for the treatment plan. Okay, let us go for the last part of this video. Just let us erase this and let us go to the last part of this video, that is, what is the treatment plan? What is the treatment? So basically for treatment of this mucormycosis, we have amphotericin B, antifungal medication, amphotericin B. Amphotericin B, that is available IV, that is we can give in the hospital setup, we can give IV, and there are injections you can also give. The injection is costing 1,500 to 2,000, I think, and typically the patient sometimes need up to 10 injection, okay, not that 10 injection they required per day, but sometimes they require typically 10 injection per day. And another medications we have, which let us discuss, and that is the liposomals, LIPOSOMAL. Liposomals are also available in the injection form, which is around 7,000 to 8,000 per injection, and typically the patient also needs up to 10 injection per day, and minimum 1 month hospitalization the patient needs. So all these things you have to be very, very careful. And if you are feeling any kind of these symptoms which I told you, like unilateral headache or a nasal pain or any kind of congestion in the nose, or you are having paranasal sinus problem, headache, and you are having pain in the vision, pain in the eye, ophthalmic region pain, and you are having a loss of vision, if you are having facial pain or bilateral headache, if you are having any of this symptom, or you may having the black tongue or something blackish coloration, discoloration in your face or mouth, inside your mouth, so you can immediately contact your healthcare provider, because this can be a case of mucormycosis. Thank you so much for watching this video, and thank you so much for loving our channel so much. And we have already crossed 750 plus YouTube subscribers, and our channel is watched with views of 15,000 plus, which I recently noticed. It is a very good news for me. Thank you so much for watching this channel, and if you like this channel, if you like this hard work, please make a thumbs up and subscribe our channel for getting more videos like this. We want to help many more medical videos, medical students around the globe. So please share this channel, please share this video with your friends and relatives, so that they can also get help. Thank you so much. Bye bye.